Tell me exactly what's happened.
She's collapsed. I don't know what's happening.
In Melbourne's Emergency Communications Centre, a panicked call for help is coming in from a farm 300 kilometres away in Alpine, Victoria.
Is his breathing completely normal?
He's breathing. Well, I just did his blood pressure was really low.
But is he breathing?
Yes, I think so.
Okay, is he changing colour?
Yes. No, you're not all right. You're on the floor. I'll get up in a minute.
While in the background, the patient's insisting he's okay. His symptoms all point to a heart attack.
Is he changing colour?
Yeah, he's cold and clammy.
Okay, I'm organising help for you now.
An air ambulance team is immediately mobilised from the city. Micah Flight Paramedic Ray knows the 72-year-old patient could be only minutes away from a cardiac arrest.
Our ETA is approximately 45 minutes.
Roger, thanks very much. 173 will meet you there.
The high country is one of the most beautiful places in Victoria. But you live out here, you're miles away from medical attention when something goes wrong.
So we might approach basically along that track running through the pad from our right 3 o'clock, mate.
If it's confirmed this patient's having a heart attack, he's absolutely and unconditionally time critical.
A local ambulance crew has already picked up the seriously ill patient and is bringing him to the helicopter.
Okay, so this is John. He has collapsed on the floor of his home. His BP sitting around the 56 on 40 kind of thing.
Okay.
12-lead ECG shows inferior STEMI.
A STEMI means a clot that's stopping the blood flow to the heart. And so it actually means your heart muscle's dying.
So, John, notice anything unusual when you're out farming?
Oh, short of breath
all the time?
Especially walking. I can walk, but an old lady will beat me.
There is a saying in medicine that morgues are full of blokes who ignore symptoms. If you get serious signs like shortness of breath and fatigue and chest pain, there could be some desperately bad things happening within your body and you really do need to see a doctor.
So what we're going to do, we're going to put all our stuff on you and quickly get you up and out of here.
The local paramedics have already given John a clot-busting drug to open up the artery to his heart. But it's only a short-term solution.
We don't know if that vessel's going to block again. If it blocks up again, which it really could at any second, we could go into a cardiac arrest literally in a millisecond.
All right, off to the Royal Melbourne for you. 45 minutes, we'll be there.
This situation has us on peak alert. John has a massive potential to deteriorate. So for us, it's let's get going as quick as we can.
How can you make an egg laugh?
How can you make an egg laugh?
Tell them a funny joke.
Tell them a funny joke.
Back in Melbourne, Amanda and Taz are starting their shift on a much lighter note.
I have a good one for you. What do you call a chicken that counts its eggs? A mathema-chicken.
But the yolks are quickly over.
We were just on a patrol and we've come across a gentleman. He's breathing, but he's sort of got the shakes. We can't get anything out of him.
A protective services officer has found a suspected drug-affected man outside the Melbourne West Police Station.
Will they be able to find you there?
Yeah, we'll flag him down.
When the job comes as drug affected, the first thing comes in mind, what kind of drugs? So someone who's taken a heroin overdose can go unconscious compared to someone who's taken an ice, where they may present possible violent behaviour.
Saying something about medication, but we can't sort of make any sense out.
Okay, let's go and find out.
Oh, he was just sitting there, was he?
Yeah, when we came out on our patrol, he's just sitting there hunched over.
Is he known to you guys at all?
No.
Nothing in his pockets? You guys have searched him and that?
If he's got syringes or knives, scissors, anything that can harm our safety, we want them out of the way.
It's ambulance here. Hello? Open your eyes, mate. Open your eyes. Can we take this bag out for a second? Thank you. I'll look after your bag.
Have a look and see if there's a wallet or something in it.
With the patient so unresponsive, Amanda searches his bag for more information.
Have you taken any drugs or alcohol? Medication? Medication for what?
That's really, really helpful, actually. Just on Mataz.
That's it?
Just on Matazepine, yeah.
Mirtazapine is an antidepressant drug often prescribed to people suffering from severe anxiety.
Yeah,
You've taken 20 of these, so you overdosed on tablet. Okay, well, we need to take you to hospital.
These drugs are pretty strong and they can have some pretty significant side effects. To take 20 times the amount you're supposed to could have dire effects on this patient.
Yeah, your bag's coming, mate. It's okay.
Take your bag. We'll take your bag.
You can never drop your guard in these kind of jobs. 1 minute they are completely relaxed. Next second they may present quite a physical aggression or danger towards paramedics.
It's me. Okay, so he's really gone aggressive now. Let's call the police officers.
No, dog, we're coming here. I'm scared. Mow him. No. Why not?
By this patient's behaviour, it's pretty evident that he hasn't just overdosed on the antidepressant. There's something else at play here, and it's really important for me to find out exactly what substance we're dealing with.
Have you had heroin today?
No.
Have you had synthetic marijuana today?
No.
Recently used ice?
Yes.
When was the last time you had ice? Yes, this
Yeah,
morning?
This morning.
You had it this morning?
Patients on ice can be really unpredictable. They can be very violent. We need to get both of us to the hospital safely.
He's all right. He's going in here.
No, it's just me.
You go.
He's watching me.
No, but he can't drive.
It's not your rules, it's my rules.
I'm listening to you.
Yeah, so listen.
I feel a little bit sorry for this guy, and I just need to be nice to him. He deserves just as much respect as anybody else who gets in the back of my ambulance.
How's that, a bit better?
Yeah.
We've got a police officer in the back, okay?
A policeman will be travelling in the ambulance to make sure everyone stays safe.
It's all right, mate. I'm just here to help you. Make sure you're safe, all right?
There's just a policeman
I'll
there.
get my phone.
No one's going to take your phone, it's all good.
Because they all know that I've got the evidence they need.
This guy is obviously having a psychiatric episode, so this transport is not going to be easy.
In Victoria's Alpine country, Flight Paramedic Ray is preparing to emergency airlift 72-year-old John to a Melbourne cardiac unit.
Just for your eyes there, John, okay?
Okay, you're in the middle of our paddock.
The farmer has just had a massive heart attack. He's only alive now because his cousin Lauren came home in time to raise the alarm.
He was lying on the couch and I took a look and he was real sweaty and clammy and really cold. So I said, I'm calling the ambulance. And he sort of come to and no, I don't need an ambulance. I'm fine. I'm thinking, you're not fine. If I hadn't called the ambulance, I don't think he'd be here.
There's the cows, Lauren.
No, the cows are right there down the bottom paddock. Don't you worry about it. We've got them all organised.
We run the farm together and I don't think I'd be able to continue on my own. With John's granddaughter, I don't think we'd manage.
Stay with me.
Despite his critical condition, John's still barking orders.
What about water?
You want a sip?
They're giving you
Yeah, I wouldn't mind a sip of my water.
Your water. You got special water? Can't even drink Melbourne water. I don't even taste the
I
quality.
wouldn't even wash my teeth.
Country guys, country people in general, tend to be laid back when everything's against them.
Suddenly, John's heart rate and blood pressure plummet.
Is that rhythm changed again? Yep, it has too. And yeah.
Ray is back on high alert.
And he starts looking terrible again. So basically that clot's reformed. His heart's getting deprived of oxygen, and the end result of this could be a cardiac arrest. And it could just happen at any time.
The only way to fix John is emergency surgery to unblock his arteries. But it will take at least 45 minutes for the chopper to get him to the Royal Melbourne Hospital.
50 feet, 2 hours 98 there.
We don't know how it's going to end. Kind of doing this a little bit. With a patient like John, chaos could be just around the corner.
When did you start injecting ice? 3 weeks ago.
3 weeks ago.
When did you start smoking it?
Oh, about 4 or 5 months ago.
Right.
Back in Melbourne's city centre, Amanda and Taz are heading to hospital with their distressed patient. He's overdosed on antidepressants and taken ice.
So you're just having a hard time at the moment?
It's just nothing wrong.
I think to be a true paramedic, you have to be compassionate. There's always a reason behind why people are in certain kind of situation.
Who are you calling?
My mum.
Your mum.
Hello?
Oh, Mum, I'm in an ambulance because I take lots of tablets because of all this stuff on social media, Mum.
Don't take no more tablets.
You come pick me up, Mum.
I can't come down and get you because my car's no good.
Just get the drive down and get me, please, Mum.
I can't.
Mum, please.
It's really heartbreaking to see someone in that situation. Do you know, he goes from being this drug-affected adult to being almost a child.
You're in the best place.
No, Mum, no.
Yes, you are.
Please. Please, Mum.
I can't.
Please, Mum, come and get me.
Can I speak to your mum?
No, just hang up on me.
Did you hang up on her?
No.
I think you might have hung up on
No,
her.
what's the phone?
I can speak to her and tell her what's happening. Oi, oi, oi,
Well,
stop!
I'll be good, but there goes the...
I can hear this patient getting angry, shouting, ranting in the back.
Stop, that's got glass on it. You're
Yeah,
gonna hurt
no, I'm
yourself.
not going to I'm going to put
You're gonna hurt
no,
yourself.
You're not taking it.
This is getting dangerous now. I need to get out and protect Amanda.
You need to stop.
Thames 1, we're airborne for the Royal Melbourne now with an ETA approximately 1610.
72-year-old John is being airlifted from his farm in the Victorian high country after a massive heart attack.
Imperious STEMI diagnosed.
Flight paramedic Ray is concerned his critically ill patient could go into cardiac arrest on the 45-minute flight back to Melbourne.
His blood pressure wasn't very good. His heart wasn't functioning very well. BP 117 on 5-4. He is on 5 mics a minute of adrenaline, but we're just titrating that.
Thanks, Thames 1.
Roger.
John is an absolutely time-critical patient. His heart's a ticking bomb. If it stays unclotted and his blood vessels stay unclotted, all good and well. If it doesn't, that actually means his heart muscle's dying. Best way to describe it would probably be you have an orchestra. Every little heart muscle is its own little instrument. If they're not playing together, you're chaotic. And if it's chaotic, your heart doesn't beat properly, quivers, or it goes too fast and it's unregulated. That's immediate death.
It's been a tense flight, and the air ambulance team are happy to see the Royal Melbourne Hospital finally come into sight.
You good there, John?
But John's fight for life is a long way from over.
Couple of bumps as we come out here, John, all right?
A team of cardiologists are on standby to take him straight into theatre.
So John's got significant cardiac vessel disease. There's only one way to fix this problem, and that's to go into surgery and get the pipes unblocked manually. And he's in no way, shape or form out of the woods.
Oi, oi, oi,
No,
stop.
I'll be good, but...
In central Melbourne, a patient on ice is becoming increasingly distressed.
You're gonna hurt
You're
yourself.
not taking it, I'll hold it.
Hey.
Taz has now stopped the ambulance in case the man turns violent.
Hey, we're not taking your evidence off you. Hey, enough. Okay, so just stop.
Before I realise it, Taz is at the side door because he's pulled over to make sure I'm okay.
We haven't taken your phone off you. I just want you to not hurt yourself.
These jobs are a highly volatile job. We have to be prepared for these kind of reactions all the time.
Just relax. Are we relaxed? Are we calm? I understand that you're going through a really tough time at the moment, okay? And we're gonna go and get you some help. The police officer behind you has got your phone, okay?
I'll keep it safe.
He's gonna keep it nice and safe for you.
The tin policeman.
No, that's a real policeman. If the police officer has it, it's nice and safe. Let's just go to the hospital. Yeah, seatbelts are all on.
Driving in the front, sometimes you feel like you're helpless. But having Victoria Police in the back, it just gives reassurance that my partner is safe.
Yeah, Roger, we are upgrading to Code 1 to St. Vincent Hospital along with 56 for safety reasons.
It doesn't matter sometimes how much support you get in terms of medication or treatment or from the hospital. Just being lonely is probably the toughest battle you can have in your life. As a paramedic, the biggest challenge for us is to make them realize that we haven't given up. We are their family. We are their hope.
As dusk falls on Melbourne, Nat and Leonard are starting their evening shift with an unusual call-out.
Oh my God! Patient was having sex when he heard a loud crack. Penis is now spurting blood.
Oh my gosh.
Oh my God.
Our job is very much paramedic bingo. We never know what we're going to go to. Okay.
Okay.
So first things first, game plan.
Well, the only way to control a hemorrhage is with digital pressure. I don't know what you're laughing about, but I'm a professional. And if I need to apply pressure to control the hemorrhage, then so be it.
It's important to actually have a laugh, get it out of our system so that when we get on scene, it's game face.
Where are we taking him? To the Alfred?
Yeah.
Yeah?
But before the team can get to the job,
No!
Why? What's happening?
a closer ambulance has been assigned the job.
715 received cancelled.
But this night's about to have another surprising twist.
Bitten by a funnel. Funnel web?
Funnel web. Oh my God.
Tell me exactly what's happened. My daughter's, who's allergic to dairy, may have had something and she's reacting at the moment. How old is she? She is 3 years old. Okay.
On the Mornington Peninsula, intensive care paramedics Doddsy and Cam are also responding to an emergency. A tiny patient is in trouble.
Does she have difficulty breathing or swallowing? The breathing is not normal. Okay. Has she ever had a severe allergic reaction before? Yes, she has.
Hives under armpits, neck, looking very uncomfortable. If this kid is truly anaphylactic, you know, minutes count.
Absolutely, they do.
The toddler's distraught mum has pulled over on the side of a highway.
We want to find this patient as soon as we can because what might have started as a simple allergic reaction could become full-blown anaphylaxis very quickly. It can lead to them going unconscious and, if untreated, possibly cardiac arrest.
So this is Craigie Road here, and I reckon if we sneak just to the right and have a look, we should see a car with its hazard lights on here.
Looking.
Yeah, hazards. Did I say hazards? No, maybe I didn't.
The Micah paramedics are struggling to find their patient.
Murdoch Highway, Craigie Road.
Back
so
there.
it's back down there.
It says on this roundabout.
When we get to the address that we were given and they're not there, we start thinking there's a 3-year-old that needs an ambulance now. We could be driving around for another 5 minutes before we find them, and I hate to think what could happen within that 5 minutes.
Go that way, go that way.
I don't think they were a Victorian.
You saying there are no funnel webs in Victoria?
I didn't think that was in Melbourne.
Nat and Leonard's bizarre night has just become a little bit stranger. They're now on the way to a suspected funnel web spider bite.
It's bitten me on my finger. I've just been vomiting. It happened about 10 minutes ago. Okay.
Keep calm, do not move at all, and wait there for paramedics, okay? So it's really important that you try to stay as immobile as possible.
Yeah, my head's feeling sore.
Funnel web spiders are found around the east coast and the highlands of Australia, from Queensland to Tasmania. Do you know what they look like?
Big, black, ugly,
scary,
disgusting.
We know that the Sydney funnel web spider is one of the deadliest in the world. I'm not really looking forward to meeting its Melbourne cousin. Patient unstable, here we go. It's gonna be can we upgrade? Yeah, let's do it. We're not really sure what we're going to. We could be dealing with a very, very unwell patient. She's been vomiting, she's feeling hot, and she's complaining of a headache. So there's lots of symptoms here. It's gonna become a 1. Yeah, it's a 1. Go, 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 go.
I'll go to the roundabout and I'll turn around.
Yep.
How am I looking yours? Okay.
Yeah, clear, let's go.
At the Mornington Peninsula, Cam and Doddsy are still searching for a 3-year-old patient who's believed to be having a severe allergic reaction.
There could be a critically unwell kid sitting in a car waiting for an ambulance and we can't even find them.
I reckon we head back down that.
Yeah, absolutely. I'm going to go across here.
Hang on, I'll just see if they're down to the left.
They're there.
Ah, yeah. We've located, thanks.
And they're standing on the side of the road holding a child.
Yeah.
We can see that the car's on the side of the road. It's in a precarious position, but Mum gets out of the car and starts carrying the kid.
They're coming straight to the car, so they're literally walking to the side of the car.
Hello, too dangerous here. We need to move.
The fact that Mum's a little bit panicked makes me think, is this kid really unwell?
Is she okay?
I'm just worried about her breathing.
Okay, I'll get you to follow me up here.
But once I can see that she's conscious and alert and looking around, I've got time to have a bit of a breath.
What's your name?
Anne.
Anne, I'm Cam. What's your name? Inna.
Annalise.
Annalise.
We call it Anna. See, she's
Anna. I just want to pull up and off
Yep,
the road
sure,
there,
sure.
and then we're safe,
No worries.
okay?
Just moving up.
Thank you. So tell me a little bit about her, about Annalise.
She's allergic to eggs, dairy and peanuts. Today we gave her a bit of a burger and I think she reacted to it. They may have been mayo in it. I don't know.
Okay, yep. So an egg-based product.
But that was around 4 o'clock. But she's been coughing. We've given her Zyrtec.
Yeah, great.
3 drops of Zyrtec. And she just started to really itch around 5 o'clock.
Okay, could you just take her top off and we'll just have a look?
With the story that Anne's telling me, the cough and the itch and the rash, it starts to paint the picture that this could be an anaphylactic reaction. This could be severe. And it's obviously progressing because she's given her an antihistamine and she's still showing symptoms.
Now, can I have a listen to your breathing with my doctor's stethoscope? Is that okay?
Yeah.
Good, thank you. I have a little listen. It gets a bit cold, okay? A little bit cold.
I've found in the past that kids sometimes get really scared at what's a paramedic going to do? Like, are they going to do something that's going to hurt me? So some of the equipment that we have to put on, I like to make up little games.
This is my hug machine. Oh, you know what to do.
I use these little tricks just to try and distract them and make them feel a little bit more comfortable.
Can you poke your tongue out for me? Good girl. And your lips? Any pain, any tingling? So oxygen levels are excellent. Her heart rate's quite good. But she's got full inspiratory, expiratory wheezes. And we've got a rash down in the thighs there. It's more of a welt rash, Doddsy, but she's got respiratory involvement as well. So what I want to do is treat her as if it is an anaphylactic reaction at the moment.
I've drawn out 0.1 of a mil, which will be 100 mics.
Okay, so
the adrenaline that I'm going to give Anna, hopefully, will fix the breathing problems that she's got and open up her airways, but we're going to have to give her a needle, and I know she's not going to like it.
Tiny sting. Tiny sting, hun. Sorry, love.
I'm sorry, sweetheart.
Sharp out.
That's all.
All done.
Here you go.
I'm sorry, hun. I'm sorry. Sorry, Anne.
Doddsy now needs to get them moving to hospital. On the way, Cam will closely monitor Anna's vital signs to make sure she doesn't deteriorate.
You happy?
Yep.
Okay. Happy to go. Thanks, Paul.
Righto, mate.
From here, one of two things could happen. The adrenaline could resolve all of Anna's symptoms, or it might not work at all and she could continue to get worse. At the moment, I'm not sure which way it's going to go.
So my understanding was funnel webs, they get compression, redbacks don't.
Yeah, right here.
Perfect.
Leonard and Nat have arrived to check out a young woman who's reportedly been bitten by a highly venomous funnel web spider.
Hi, sweetie. What's happened?
I was rolling the smoke.
Yep. So hand into the pouch of tobacco.
Yep, put it in there, felt something on my finger,
Yes.
and then I saw it, and then I just threw the whole thing away.
Okay, are you certain it was a funnel web?
Well, that's where they all are. So.
Okay. Where were you bitten, Jess?
On my finger, yeah.
The right finger there?
Yep.
Okay, and?
About 10 minutes after, to get really hot and sweating, and I started throwing up.
How many times have you thrown up?
Twice.
Okay. Do you feel dizzy at all?
Lightheaded.
Yep.
Very hot.
And do you still feel nauseated in the stomach?
Yeah, and I feel really hot.
Really hot?
Yep.
Okay.
If it is a funnel web spider bite, that venom could be quickly circulating around this patient's body. And if that happens, within a few minutes, the patient can deteriorate. Think in the truck, start moving, assess. It could seriously end up as a life or death situation.
Hey mate, how you going?
Doxy, good to see you.
Good to see you. How was your holiday?
Also on the night shift, Mike's catching up with Eamon after his partner took a short break to Bali.
I actually got you something.
Okay. I know you love your utility belt.
Oh, God.
And you look like a bit of a nuffy with a utility belt, but I disagree. So
Batman doesn't look like a nuffy.
So I thought you could maybe wear this T-shirt with pride. Utility belts.
Man,
cool.
I'll wear that under my uniform. That's fine.
Mike is hands down the biggest dag I know. He's late 20s going on late 60s.
You think this is a joke? I love this. I have to buy you a coffee.
But coffee will have to wait.
All right, let's put this away.
An urgent call has just come in from a woman in distress.
Emergency services, tell me exactly what happened.
I'm short of breath. When I breathe, they stab me around the heart.
Okay, I'm going to get you help.
We're going to a 72-year-old female who's short of breath and has pain in her chest, and that's all we know.
Mike and Eamon are now heading lights and sirens to this time-critical case, but details are in short supply.
Pain in the chest with shortness of breath, you know, that adds a layer of complexity. It may not be a heart attack, but it could be like cardiac failure. Yep. Perhaps. There's so many things that it could be. I'm thinking, is it a chest infection? Is it their heart is failing and they're getting a build-up of fluid in their lungs? Or is it something as serious as a heart attack? With a 72-year-old patient, all of those things are highly probable. Her name is going to be Tula. Tula.
After sorting out the clinical possibilities, the boys have time to play their favourite game. Guess the patient's name.
Tula, what do you reckon her name's going to be?
Ingrid.
Ingrid or Tula? We're heading into a very Greek suburb. This could be the one.
Let me just back her up a little bit, mate.
I reckon her name's going to be Tula. I'm feeling bloody good about her name.
Yeah, bloody good. Well, I owe you a six-pack if it is.
I want a whole slab.
Now, don't accidentally call her Tula.
Yeah, g'day, Tula.
How
did you know? The excitement's building. We rock up to the house. Hello, my name's Eamon. What was your name? Milia. Damn. What's been happening today?
Short of breath.
Okay.
And all my bones crashing, all my joint and headache and...
Okay. All right. And you've got pain in your chest, do you?
Yes.
Can you point to where it is?
In here and they go that way, underneath the shoulder.
Underneath your shoulder?
Yeah.
Okay. Anytime a patient tells me that they've got stabbing pains in their chest, it's a red flag straight away. Does it feel heavy or it's like someone sitting on you or like someone stabbed you with a knife?
I can't. I'm short of breath.
No, I can see that. I just want you to lean forward and I'm going to have a listen to your breathing.
A patient with chest pain can have a major heart attack, collapsed lung, major chest infection leading to like blood poisoning or sepsis. There's really serious conditions in there that can be fatal.
We're going to look after you and take you up to the hospital, all right?
Do you have a nest of funnel webs?
Yeah.
Nat and Leonard are preparing to move Jess, who could have been bitten by a dangerously venomous funnel web spider.
They're like all in the holes, like
right.
You can't actually see them
right.
until they come out at night.
Right.
The family, who are renting, have been living in fear of the spider since they moved in.
You've got a child, do you? Or
I've got three. They don't go outside though.
Because of the spiders?
Yeah.
Okay. The thought of spiders coming out of the walls at night, it's just the stuff of nightmares. I couldn't imagine anything worse. And is this... And you'll stay here with the kids? And you know you've got the oven on. Do you want me to turn it off? I automatically go into that mum mode. I just want to make sure that everything is organised. Just that one? The oven's turned off. You know, no one's going to hurt themselves. And then we're not going to be coming back to pick up another patient. The kids had dinner?
Yes.
Yeah, they're good? Okay, your dinner's in the oven. Yeah, I know. Work it out.
We need to hope for the best. We need to treat for the worst.
Are you in pain, Jess?
No, I feel really sick.
Do you? Like you're going to vomit again? Okay.
We've got a vomit bag right next to you.
The standard procedure for any funnel web spider bite is to apply compression to the entire limb. Before they can leave, Nat and Leonard need to bandage Jess's entire arm.
Fortunately, they have to be put on quite tight. Just keep it still. You're going to feel like a robot. What we're trying to do is prevent the venom from going back to the heart and then spreading around to other vital organs. You all good, Nat?
Yeah. Well, we know that funnel web spider bites can be fatal, so even a little bit of venom can have serious side effects.
Her heart rate's still a little bit elevated because I've given her a little bit of adrenaline. Yep. So I'm just going to monitor her.
Intensive care paramedics Doddsy and Cam are on their way to hospital with 3-year-old Anna and her mum, Anne. The toddler has suffered an anaphylactic reaction after eating a burger with mayonnaise earlier today.
Anaphylaxis is one of those things that there's something in her body causing an extreme inflammatory response. And what I've done is almost put a cap on it, but when the adrenaline wears off, some of those substances can override that inflammatory response again. So I'll have a listen to her breathing and see if we've helped her. If we have, fantastic, I'll leave it alone. But if not, I might have to give her another one. Yep. I'll have a little listen to your breathing again, okay? Big breath. What about your tongue? Can you poke your tongue out at me again? Does it feel puffy? It does.
So when I look at Anna, the welts have gone down, but she's saying that her tongue feels a little bit swollen. This is a major concern because kids only have small airways. If Anna's throat continues to swell or her tongue swells, she could occlude her airway and she wouldn't be able to breathe at all. Then we'd be in real trouble.
Okay, special mask. Let's pop this on. Big breath for me. Big breath. Good girl.
Cam's giving little Anna a second dose of adrenaline, this time administered through a face mask.
And are you okay? Yeah, cool.
Hopefully it will keep her airways open until they get to hospital.
Just pulling in now.
Beautiful. How do you feel? Just a bit tired now?
Anna will now be taken straight to emergency for further testing and observation.
Okay. Right to move out, nice and easy.
Anna's pretty lucky that her mum was so switched on to the fact that she was deteriorating and it was out of the normal. She was more severe than she had been in the past, so ringing an ambulance was spot on.
All right.
How's the nausea?
It's still there.
Still there?
Yeah.
Okay.
Nat and Leonard are also on their way to hospital with suspected spider bite victim, mother of 3, Jess.
You've done all the right things. You've sat down, you've kept still, all the things that we'd be looking for.
They've bandaged her arm and are now trying to keep her as calm as possible to stop the dangerous venom from the funnel web spider spreading around her body.
So how long have you been renting there for?
3 years.
Okay, and how long have you had the spiders for?
3 years.
Oh my goodness, so they were there when you moved in?
Yeah.
So this is an ongoing problem?
Yeah, it's too expensive to move.
Yeah, well, you've got 3 kids. You full-time mum at the moment?
Yeah.
Yeah? It's tiring, isn't it? I feel like I can relate to Jess a little bit. We're both mums, 3 young children. I've got a 4-year-old. He goes to the toilet and he goes, Mum! I go, what? Wipe my bum!
Is that what I've got to look forward to now?
You do. Leonard's having a baby in a few weeks. Have you ever heard of a punami?
Oh, no.
You know what a punami is?
Is that like a number poo-poo explosion?
Sometimes I can't tell the difference between when Nat is telling the truth and when she's just trying to rev me up a little bit and scare the crap out of me.
That better be a myth.
He's having his first. He's got no idea. Oh,
I'm not listening now.
you have no idea what's coming.
La 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 la.
I'm actually worried. I just don't think I'm going to have another kid after the first one, if that's true.
While Leonard deals with first-time father jitters, Jess will now be taken into emergency and kept under close observation.
Okay.
She is still at risk of a life-threatening reaction if too much of the venom is circulating in her system.
Will your husband be able to make himself dinner?
Without burning the house down. Although if he burns the house down, he might burn all the funnel webs.
Yeah.
If you take a big breath in, for example, does that hurt?
Yeah. In Melbourne's southeast, Eamon and Mike are trying to work out what's causing the stabbing pains in Milia's chest.
Just gonna pop some stickers.
Are you bringing anything up? Any phlegm? What colour is it?
Yellowish.
Like a yellow colour. Okay.
Patient with chest pain can
have a heart problem and a lung problem simultaneously. If the heart's not pumping effectively, fluid or blood builds back up into the lungs and you can essentially drown on the inside.
Are you a smoker?
Yeah.
Yeah.
How much are you smoking at the moment?
10.
10 a day? She's coughing up some gunk, her bones are aching, she's got a temperature, and she's feeling short of breath.
ECG is normal. I think it's definitely all fitting a pleuritic sort of pathway.
This is sounding less like a heart attack and more like a very serious infection. Did that make the pain worse than when you had a cough? Yeah. Yeah. That's what's giving you this chest pain. Because you're coughing so much, you're straining the muscles in there.
There's not much we can do for the cough, I'm afraid, but the pain we will try and help, and we'll take you to hospital for some tests. You need a chest X-ray and some blood tests, all right?
Chest infections, in the beginning, they're quite benign, cough, cold, runny nose sort of thing. For a patient like Amelia, she's older, she's a smoker, she's got lung problems. It can progress to be quite serious, and then because her immune system's not as good as a younger person, it can spread to other body systems and eventually lead to organ shutdown and death.
All right, Eamon will come in the back with you, OK?
I'm good to go when you are, mate.
Moving on.
Amelia needs to go to hospital. We need to get on top of this before it gets on top of her. Heart rate's good, blood pressure's good, stats are good, still a bit uncomfortable.
Is there temperature?
You've got a temperature as well. So it all...
Last night when I start to have that stabbing pain, I was scared.
Yeah, no, I understand. It can be very scary when these things happen.
Oh.
Sorry, Mike's first time driving.
Not bad for my first time.
He's had his licence for 2 weeks now. No, I'm joking. He's had a long time.
I'm only 16.
One thing I can do straight away for Amelia is to make her smile. And the best thing I've got in my arsenal at the moment is the charm offensive. You know, it's okay. We'll look after you, all right?
Yeah.
We'll take care.
My grandson.
I'm your grandson?
Of course.
So does this mean I can come over and you'll cook me dinner?
Yes, when I get better, why not?
Perfect. I'll be there tomorrow. How's that sound? Mike, what are you doing for dinner tomorrow night? We're going to Amelia's.
Going to Amelia's?
I can't do it.
You need to rest. I think patients, they never remember the medications we give them. They don't remember the procedures. What they remember is how we interact with them and how we made them feel. Maybe if I was 40 years older, you and I.
You're beautiful.
Whenever I go to a patient like Amelia who's home alone, I think of my own Nana and think, oh, when was the last time I checked in on her?
Few bumps and noises, OK, Amelia?
For part of me, all of these older patients are a little bit my Nana, and I want to treat them as they deserve to be treated.
That might be your fever breaking because you've had some Panadol.
Amelia will now be given a chest X-ray to find out just how serious her condition is.
I'm a bit dizzy.
Could be my driving, let's be honest.
Definitely your driving.
Are you certain it was a funnel web?
Well, that's where they all are.
Where were you bitten, Jess?
On my finger here.
It's been 2 weeks since Mum Jess was bitten by what she believed was a highly venomous funnel web spider. Jess was treated with anti-nausea medication and monitored overnight before she was allowed to return home to her family. The other good news is the landlord did organise pest control, and Jess's 3 kids are now safe to play in a spider-free backyard. Amelia was diagnosed with a severe chest infection and required multiple courses of antibiotics. The 72-year-old spent 5 days in hospital before she was well enough to return home.
So does this mean I can come over and you'll cook me dinner?
Yes, when I get better, why not?
Perfect. I'll be there.
As for Eamon, he's still looking forward to his dinner invite.
So she's allergic to eggs, dairy and peanuts.
3-year-old Anna had an anaphylactic reaction after eating a burger with mayonnaise.
Sorry. I'm sorry, sweetheart.
She remained under observation for several hours and was discharged later that night. Doctors have confirmed she's allergic to eggs, and the toddler's mum now makes sure her little girl has an EpiPen on hand at all times.
There's the cows, Laurie.
No, the cows are right there down the bottom paddock.
72-year-old farmer John was at serious risk of going into cardiac arrest after having a massive heart attack.
You stay with me.
At hospital, he underwent emergency surgery that saved his life.
Come on, over here!
Back on the farm, John's enjoying his second chance.
They know your voice.
Yeah. Lauren was persistent. She called the ambulance. I told her not to. But being in their hands was absolutely fantastic. I actually trusted my life with them. Yeah, I'm dangerous when I've got this in my hand.
Knock you out.
Since the heart attack, John's making the most of every day.
He's a lot more healthier and he's a lot more, a bit of a spring in his step. He's just a ball of fun now.
Aren't you glad I'm alive? Eating good pizza.
It is good to have him back. He's stubborn, but much improved now that he's had his operation.
Here's to those wonderful paramedics. Good luck to you, Ray.
All right, is he awake at the moment?
Is he awake? No.
Is he breathing?
He's got the blue and he's all white and he's leaking blood and he's unconscious.
Micah paramedic Cam is sent on a priority 0, the most urgent call out of all.
The problem with blood is it's easy to fall out, but we can't put it back in. Worst case scenario is you could die. Who knows what kind of scene we're about to walk into. Hopefully he's not still stuck in the window.
But another crew has already found the man collapsed in the backyard. He's drifting in and out of consciousness.
G'day, my name's Cam. Sammy, are we going to be right to just go, mate?
I'd say so, mate. We haven't got access yet. I just want to get him on and get him in.
Yeah. What's his name?
Jared.
There's so much blood. He's definitely hit an artery or a major vessel, and I start thinking he could be bleeding out in front of us right now.
Knock, knock. Hello. Hey.
It's a much happier start to the shift for Nicola.
It's a nice surprise. I know.
Her regular partner and work bestie Risky, who's on maternity leave, has popped in for a visit.
This little one.
Here. Eve.
Yep.
Hello. Oh, she's so tiny.
You want to hold?
Absolutely.
This is the first time Nicola has met baby Eve.
It's amazing to see Risky today. Being a mum seems like a pretty tough job, but she looks like she's handling it really well. So I'm working with Leonard. It's pretty fun. It's no Risky though.
No, I wouldn't think so.
No. Still need my work wife.
Still miss me?
Absolutely.
So Nicola's teaming up with Leonard today. He's a good guy and I'm happy to share her, but it is stealing my territory a little bit.
What's all the sucking? Didn't you like your Auntie Nicola?
Little Eve is so cute and I can definitely see hints of Risky in there, but it does make me concerned because I'm not sure the world is ready for more mini Riskies.
You can probably have her back now.
Okay, sure.
She doesn't like me very much.
Emergency services. Tell me exactly what's happened.
It's my neighbour, slipped and has fallen and she's screaming.
A few kilometres away in the State Emergency Communications Centre, a call is coming in from the worried friend of a badly injured grandmother.
What part of the body was injured?
It looks like she may have fractured her hip.
Okay, she's still on the floor.
Yes, she is.
As the closest crew in Melbourne's northeast, Leonard and Nicola are on their way to the elderly woman under lights and sirens.
So Leonard, fall, query, fractured hip, 71-year-old, mechanical fall outside, no head strike, patient is screaming.
Oh, screaming.
Yeah, it doesn't
A lot of pain. Any time that I get sent to a patient with a potentially broken hip, the first thing that I think of is pain, and a lot of pain.
Hi, so who are we here for?
Oh, my mum.
What's your mum's name?
Doris.
Doris?
Yep.
Doris?
Yes.
Hello, my name's Nicola. I've got Leonard with me as well.
Oh.
So when you fell, did you land on this hip here?
Yes.
And then you've rolled over, have you?
Yes.
Did you hit your head at all?
No.
Do you know what day of the week it is today, Doris?
It's Saturday.
Saturday. And do you know what month?
I know everything.
Yeah, we just need to make sure. When I see Doris lying on the ground, it's obvious that she's in an excruciating amount of pain. So I do some physical checks of her head and neck to make sure there's no other injuries there, and I'm pretty confident that this is just isolated to that hip. We'll just check your blood pressure and your heart rate, then I can give you something for your pain.
Before Doris can be moved to the ambulance, she needs fast-acting pain relief.
Have you had the green whistle before?
You pop it in your mouth and you got to breathe in. Keep breathing, deep breaths into the green whistle. When a person is in agony, they can often release a lot of adrenaline, and that causes the body to shake uncontrollably, which is happening to Doris right now. That's it. Breathe. So we really need to get stronger pain relief on board fast, because I don't know how much more pain Doris can handle. Doris, focus on breathing in.
Big breaths.
Every time you want to scream, you breathe in.
Can he stand or not at all? Yeah, okay.
Intensive care paramedic Cam is worried 28-year-old Jared has severed an artery in his arm after crashing through a plate glass window.
Just relax, mate. We're going to get you into the ambulance, okay?
That's it, mate.
Before he can be rushed to hospital, the paramedics need to check him for more injuries. If he's lost too much blood, Jared could die.
Oh, there's a lot of blood on there from something.
Yeah, he might have bled down onto it, so...
Yeah, rolling. Yep.
Okay, let's go. Just monitor off.
Yep, that's it, mate. We're going to take care of you. Roll on your side.
Okay.
Nothing went back.
All good, thank you.
Sam and Lauren have done an amazing job. They'd put a combat tourniquet on Jared's arm, but there's blood all over the ground. There's blood on the porch. There's blood everywhere.
Jared's mum, Julie, called paramedics after finding her son unconscious in the backyard.
When I found him, he wasn't in a good way at all. He'd had a terrible blood loss. It was quite clear that he was in a lot of trouble.
Can you give us a hand just to lift him up onto here, please?
Only sorry.
Just watch your back there as well, mate. Okay, we're just on the sides like this.
As a parent, I'm watching my son hurt and just praying that he's going to make it through.
What's your footing?
That's it. And down we go.
Okay.
Keep your arms in, mate. We're trying to help.
Jared, put your arms down, mate.
Big breaths.
71-year-old Doris is also in a bad way with a suspected fractured hip.
That's it. Big breath.
Nicola and Leonard are giving her fast-acting pain relief to try to make the grandmother more comfortable.
We're going to try and get a needle in, give you some more pain relief.
Well done.
When did she fall? Like, how long ago?
Maybe
10 minutes? Yep, sure.
it looks like you're cooking, my dad.
Looks like it, doesn't it?
Doris was preparing a meal for family when she slipped and fell. Husband Simon rushed to her side when he heard her cries for help.
She was going through a lot of hell of a pain. It is very hard, but I have to be there at that moment to be strong for her. I said, please, God, help her, I mean, I need her. I need my wife.
The way that her leg is at the moment indicates to us most likely she's fractured the neck of her femur, so up high in the hip.
If Nicola's right, Doris will need surgery and months of rehab. As full-time carer of epileptic daughter Norma, it's a devastating setback.
She's the rock. Without her, we struggle. As her son, I'm worried for her, but I'm trying to hold it together and trying to make Dad think that, it's okay, everything's going to be good. She'll be okay.
So, Doris, we're going to have to move you in a second. Now, it is going to hurt because we're going to slide you up a ramp and then onto our stretcher.
Don't worry about tomorrow. Hey?
You're all right, Doris. Get your family here. That's the most important thing.
With a big dose of morphine on board, Doris can now be moved into the ambulance.
You can take a few deep breaths now, Doris.
Big breath.
No,
Big
no, no.
breaths.
Put it in your mouth.
Put that whistle in your mouth,
Doris.
Big breaths. The problem with the hip area is that it's involved in all your movements, so it can be really hard for us to completely eliminate pain. Getting Doris onto our stretcher is quite a struggle, but we have no choice. We need to get her to hospital. Big breath.
Every time you want to scream.
Big breath.
Keep breathing on it.
We're going to give you some oxygen in the back of the ambulance, OK, Jared? Pop your arms in for me, mate.
Single responder Cam is desperately working to get Jared to hospital after the 28-year-old smashed his arm through a window.
It sounds as though he's lost enough blood that he needs it replaced. I don't have blood on the ambulance, so I'm thinking, whatever we do, let's get moving.
Just relax, it's all right.
Dad Alan tried to stem the bleeding using his shirt as a bandage.
It was absolutely pouring out, coming out of his arm probably that far. He was in a really, really bad way. And he just kept saying, I love you, Dad. I said, I love you too, mate.
OK, mate. OK, mate, you're doing well.
Keep your arms in, mate. We're trying to help, OK?
Nobody knows what caused Jared's accident today.
He'd been drinking pretty heavy through the day, been doing it for a few days, and came in very argumentative, had a little bit of argument with me. I don't really know what actually happened then.
Hey, Jared. Jared, open your eyes.
Jared desperately needs a blood transfusion at hospital. Until then, all Cam can do is give fluids through a drip.
Jared, open your eyes for me, mate.
It's really hard to deal with Jared because he's distressed and agitated, and I don't know if it's just he hasn't got enough blood pressure to the head or something else is going on.
Cam,
Yo.
what's history of amphetamine use? He may have been using today.
OK, thank you. He's got a little bit of the sweats. No obvious head injury. OK, I'm going to need a hand just to get the IV in. Jared, I've got to put a little needle in, but you need to stay really still for me.
Jared's not really compliant to my instructions.
Still, mate, still. Jared.
I need to get this needle in his arm so I can give him some fluid. If he continues to deteriorate, worst case is he's lost so much blood, he might even go into cardiac arrest.
Really still?
Stay nice and still, mate. Don't move. Don't move.
In Melbourne's city centre, good mates Mike and Eamon are passing the time between jobs.
Who do you think would win in a fight between a grizzly bear and a gorilla?
Grizzly bear.
You reckon? I bet gorillas.
Claws.
Yeah, but the gorillas are so strong.
The bear, unless it's winter, in which case he'll be hibernating.
I like Foxy. He's a massive dag. No, there's no hibernating.
Then bear.
If the grizzly bear's awake, it's got claws. It's definitely going to win.
With one of life's big questions now figured out, the team is being called to a real fight at a nearby martial arts centre.
Right, what do we got? It's a jiu-jitsu class. And he's landed on his elbow and it's popped or fractured. And he's 25 and that's all we really know. All right, what is his name going to be?
Oh, yeah. I want to say Brian, but I think I reckon 25's too young, so I reckon Ryan.
Ryan, okay, I like it. I'm going to say his name is Andrew or Andy. I'll take anything.
I'll give you that.
Andrew or Andy. Another game Foxy and I like to play together is guessing a patient's name on the way to a job. We've currently got a 0% strike rate, but we're feeling confident. One day. G'day, mate. I'm Eamon. I've got Mike with me.
G'day.
What was your name?
I'm Mark.
Mark. So I guessed Andrew, Foxy guessed Ryan, and his name was Mark. That's probably the closest we've ever gotten. And that's not even close. What's happened? Did you hear sort of like a popping sensation?
Yeah, I had a really huge crunch. So I kind of bent kind of like that.
And how are you going sort of moving those fingers? That feels normal? No sort of altered sensation there? Okay. You didn't hurt anything else, you don't think?
No.
It sounds like Mark was doing a takedown and he somehow landed awkwardly on his elbow. I'm worried that maybe he's dislocated something, torn a ligament, or broken a bone maybe. So whereabouts is the pain exactly?
Oh, there it is.
Oh, yep.
Yeah, that's quite tender. Yeah, okay.
Mark will need an X-ray to find out just how much damage he's done.
So we are going to have to walk you out to the ambulance. So I'm going to give you the green whistle.
Tastes pretty average. Pop that. Yep, hold that in there. The book says it tastes like juicy fruits, but it tastes nothing like juicy.
I've never had a juicy fruit that tastes like that.
No, because no one would buy them.
A splint is applied to help with Mark's pain, but it's nowhere near as good as the green whistle.
How you going with that?
I'm good. I'm pretty good stuff.
Yeah, that's not even the strongest.
I don't do anything that strong.
It's a low-dose anaesthetic, and people react to it in some really bizarre ways. Some people are two-pot screamers, and they'll be off chops after a couple of puffs. Take it slow, mate.
Yeah, don't trip over anything, because we've got a lot of crap everywhere.
All right, hold up, mate. You're on the run. Mark was a pretty upbeat guy anyway, and he was off like a rocket.
Just stay active. Don't break anything.
With Mark flying high, the only person heading for a takedown now is Mike.
Yeah, if anyone wants to just have a roll with Foxy and just put him through his paces...
I'm tougher than I look. Eamon just threw me under a bus. We're in this room of almost trained killers, and he asked them if they want to fight me.
And after you break him, he can fix himself.
Yeah.
Breathe in. Well done.
Nicola and Leonard are still working hard to get 71-year-old Doris into their ambulance. Even a large dose of morphine hasn't been enough to completely ease the excruciating pain from her suspected fractured hip.
Keep breathing. Keep breathing on that. That's it.
That's it.
Doris is in a lot of pain, and the family are watching on. You can just tell the emotions that they're having right now, watching their loved one be in so much agony. To me, it was evident that this was a really tight-knit family.
It's going to go in 2.5 now, Leo.
It's all right. You just get better, yeah? Don't worry about us.
Bit more morphine, Doris, okay? You've got a very nice family there.
And my husband, he survived his cancer.
Did he?
He's the one who got it first. His brother, who got it second, his brother, well, they both gone. Lost my best friend also.
Lots of grief in your family. Yeah. But you're still going strong.
But Doris will need all the strength she's got. Recovering from a serious hip injury will be a tough battle.
I really feel sorry for Doris. For somebody of her age to fracture a hip means a really lengthy stay in hospital. She's going to potentially have multiple operations, which is going to put her at risk for infections and even pneumonia. So this fracture of a hip could really tip her over the edge.
How are you going? Do you need any more medicine or you're okay for now?
As they arrive at hospital, doctors are standing by to assess how badly Doris has damaged her hip.
Got quite a story, Doris. I was listening to it all.
Jared. Hey, you're doing really well, mate. I'm trying to fix you. You put a really nasty cut in your arm. Do you understand?
Under lights and sirens to hospital, Cam is finally getting life-saving fluids into Jared after a massive loss of blood.
So that's running through nicely, mate.
Yeah, so I just want to give him 250 mils and then reassess.
The 28-year-old has been agitated since smashing into a window at his parents' house.
His dad did say that he might be ice-affected as well.
He's got the alcohol breath as well.
Yeah. He seemed quite intoxicated when we got there.
You know, if all of our patients were compliant and followed our instructions, it'd be great. But often people are affected by drugs or alcohol, and they're often the most challenging cases we do.
Hey, mate, you're in the ambulance. Can you hear me? Not if you can hear me, mate. Good man.
If that's his true blood pressure, mate, I'm happy to put another 250 mils in. We didn't really get much improvement with it.
If he's to survive, Jared urgently needs a blood transfusion.
Hey, Jared, we're at the hospital. Do you understand? Lost a bit of blood putting your arm through the window, mate.
It's the last in a long line of dramas for Jared's long-suffering loved ones.
Jared was having a really bad time leading up to this. His drinking was putting a lot of pressure on our family.
Okay, nice and easy.
We went through some very, very bad periods. He was on the ice. Unless you've been a parent, you've been through it, people won't understand it.
Off you go. Yep.
As they arrive at the emergency department, the anxious wait begins to see if Jared's troubled life can be saved.
My biggest fear for Jared is that he's not going to make it. It definitely is every mother's worst nightmare.
Hang on, Jared.
All right, head this way, up the stairs.
This is my partner, so is he okay if he comes?
You're most welcome to come with us, chauffeur.
In the city, Mike and Eamon are beating a hasty retreat from the martial arts centre.
Left. That's it, mate.
Their patient, 25-year-old Mark, is heading to hospital for x-rays with partner Bruce.
All right, too easy. You get that seat facing backwards.
Just before they left, Eamon volunteered Mike for a wrestle with Mark's teammates.
As soon as I mentioned that maybe Mike have a fight, he was filthy.
Do you guys get to pick who you're paired with?
Generally not, but fortunately Mike, he's just struck absolute gold working with me. He's probably the luckiest bloke in the ambulance service.
I can definitely see that.
So they tell me. All right, just moving on.
Mark, who could have seriously injured his elbow, has been in high spirits since Mike and Eamon arrived.
So the bloke you were wrestling, rolling with today, is he a fairly advanced fighter?
We were practicing something called a takedown, and I landed on my left arm in a weird position.
Yeah.
And then everyone stopped, and I became a celebrity for a small amount of time.
I know, I felt so much pressure working under an audience there. And how did you gentlemen meet?
We met 7 years ago at university.
You have to put a ring on it soon.
We have.
There you go. Got it. Well, congratulations. That's exciting. One of the most interesting things about this job is the people you meet. Mark and Bruce are so nice, and it's jobs like this that make our job so enjoyable. How was the wedding? When was the wedding?
We didn't have a wedding.
Oh, you just kept it pretty chilled?
Just decided to...
Keep it low-key.
Keep low-key, and like that money that would have potentially been spent on the wedding, we would prefer to go to children, like, you know, down the line.
Yeah.
Because, you know, we cannot naturally conceive, unfortunately. Unless a miracle were to be performed upon one of us.
What I liked about Mark and Bruce is despite all of this stuff going on, they had a smile on their face the entire time. They're so obviously in love. They seem to be kicking all sorts of goals together.
Oh, this is very...
Yeah, they're all hydraulic now. Yeah. Makes much easier on our back.
It's how blokes with little chicken arms like Eamon and I can get into the job. Oh, you can come along with him. All right.
I feel sort of special.
Well, you're special in a way.
Yeah, that's what my mum says.
Yeah, my mum says that too.
Mark's elbow will now be x-rayed to see how much damage he's done and how long he'll be waiting for his next takedown.
Mark, he was the friendliest guy ever, I think. I mean, it might have been the drugs, but...
It was even before that, though.
Yeah.
He was so hyper and just happy to see us, which no one ever is.
Yeah.
More importantly, a horse-sized duck or 100 duck-sized horses. Who would win?
Horse-sized duck?
It's huge.
By the way, I would like to see the fight.
Emergency services. My son Daniel, he's starting to have a seizure now. He's turning slightly blue. Well, there's a lot of white froth pouring out of his mouth.
In Melbourne's southeast, intensive care paramedic Dodsey is on his way to the worried mum of an epilepsy sufferer.
Patient having convulsions, effective breathing at code 0.
99 received.
The 26-year-old is having a potentially deadly fit known as a tonic-clonic.
This gentleman sounds crook.
The tonic-clonic seizure is that classic one that people talk about of the person shaken quite violently and they lose consciousness and hit the floor.
Hello.
It can lead to a whole myriad of complications if it's not treated in a timely fashion.
How you going, mate? What's going on, buddy? Yeah.
Daniel has had multiple seizures.
But Dodsey arrives to find Daniel's tonic-clonic has now turned into a string of smaller fits.
This evening, skipped the 5 milligrams IM as per the treatment plan.
Yep.
Has clearly not worked.
Yeah.
He's been given a drug, midazolam, to stop the seizures. But Daniel has a history of not responding to treatments.
He's also had seizures at 1743, 1750, 1802, 1848.
Yeah.
Daniel's been having seizures every 5 minutes, every 10 minutes. That translates to me of 100 plus seizures a day, which is massive.
I'll see he's going again.
Daniel. Daniel.
Across town, Nicola and Leonard have just been called to their second emergency of the day.
Someone 5 received code 1.
A 7-year-old at a hotel in the city is having an asthma attack so severe he can barely breathe. Nicola knows it's going to be a difficult case.
Patients experiencing breathing problems are really critical and they can deteriorate so quickly. And to add to that, if you know you're going to a kid who's struggling to breathe, things can get pretty stressful.
Actually sounds like he's a bit sick, this patient.
Oh, they're behind us.
The mic up?
Intensive care paramedic Dom has also been called as worrying news filters in about the boy's oxygen levels, or SATs.
It's like stats of 85%, subunit given, no effects.
So when the update comes through that this child's oxygen levels are 85%, alarm bells are going off in my head. Normal oxygen levels should be closer to 100%. So 85 is absolutely catastrophic.
Fletcher.
Oh, hello, Fletcher.
Fast-acting first aid officers at the hotel have given Fletcher oxygen through a mask, but he's so sick, it's not enough.
This kid is really struggling to breathe. I can hear him gasping for air, and when I look at him, he looks petrified. We need to act fast.
Daniel. Daniel.
Dodsey is with 26-year-old epileptic Daniel, whose back-to-back seizures are not responding to treatment.
We had a little bit of a scare because he did have a tonic-clonic today, which is not normal for him at all.
Yeah.
Daniel's parents, Hannah and Dimitri, called paramedics after an earlier tonic-clonic fit started affecting his breathing.
Lips usually don't turn blue. Today we noticed it.
So it's elevated more so than it's normal. Yeah. What's his other ongoing medical issues?
Rasmussen's.
Encephalitis.
Okay.
I think there's 8 cases in Australia.
So Mum and Dad, tell me that Daniel suffers from a very rare disease called Rasmussen's encephalitis. This is something that I wasn't really aware of, so I need to draw on Mum and Dad's experience and knowledge around this.
We're happy if there's 2 seizures a day. That's sort of normal. But he has been going downhill for the last few weeks.
So they produce a book. This is something that they document 24 hours a day, 7 days a week. So their treatment is exemplary.
Daniel's encephalitis causes mental and physical disabilities as well as daily seizures.
Daniel's first episode was at school just before he turned 10. We've been told that it could be from a virus. Others believe it could be genetic. No one really knows.
Until diagnosis, Daniel's life was normal. Now, the whole family lives in fear of his seizures.
At present, he's fitting every minute and a half. It's heading to a situation where only hospitalisation can save him.
Daniel needs to be taken to an ICU and heavily sedated.
Midazolam, 5 milligrams in 1 ml.
In the meantime, Dodsey wants to give more of the drug midazolam, But Dad Dimitri isn't keen.
We need to stop the seizure activity, so...
It might not happen.
OK. I'll leave him be in this aspect. If he has a tonic-clonic seizure or I think his airway's compromised, then I'll treat him. Other than that, I'm happy to leave it.
Yes, please.
All right?
So we come to a compromise. If he is to reach a tonic-clonic seizure at any stage, we would treat him with midazolam. If Daniel was just presenting with his normal seizure activity, we would sit on it, make sure he was okay, and deliver him to hospital.
But transporting Daniel won't be easy. He's still drifting in and out of consciousness, and his condition could quickly deteriorate.
We'll take good care of him, OK?
Nicola and Leonard have just arrived to help 7-year-old asthmatic Fletcher, who's fighting for breath in a hotel room.
I'm gonna pop some stickers on you, mate.
Hotel first aid staff called for help when Fletcher's oxygen levels plummeted to terrifyingly low levels.
As I look at Fletcher, he is struggling to breathe, he's coughing, but I actually recognise it's croup. It's definitely croup. It's got that distinctive barking cough. I'm gonna give you some medications to make you feel better.
Croup is an infection causing swelling in Fletcher's airways. With asthma adding to his problems, he's at risk of respiratory failure.
Hey Fletcher, what we're gonna do, we're gonna swap you for a better mask. All right, you ready? Firstly, we need to give him adrenaline in a nebulizer, and what that does is it reduces the inflammation in his throat almost immediately so he can breathe straight away.
Is that helping your breathing, Fletch? Yeah. We'll let that medicine go through and then we'll give you a bit more, eh?
Fletcher and Dad Ben are supposed to be enjoying a fun city break.
You feeling better?
Any sightseeing now will be from the inside of an ambulance.
Come down for a holiday to Melbourne with Dad and look, this will happen, right? Now, Fletch, we need to get you on our big stretcher. You think you'll be all right to crawl across there? Man.
You right? Good job. And you sit down there.
Now, we've got some special medication for you. You ready? Bit of orange juice.
On top of the oxygen nebulizer, Fletcher is given steroids to help with the swelling.
There you go.
But he's still not out of danger.
So the medication that we've given Fletcher is going to help him in the short term, but we still need to take him to hospital because this is a dynamic illness that could get worse over the coming days.
Hi, mate. How you going? So we're going to take good care of you, all right, buddy?
26-year-old Daniel is still having repeated epileptic seizures and needs to be heavily sedated in hospital. Dodsey is preparing to take him under the watchful eye of Dad Dimitri.
Absolutely, I will. That's why I'm going to put Dave in the back with me, and Dave can look after his airway and his head to make sure that it's nice and straight when that happens, OK?
Thank you very much.
You're very welcome.
It has to be challenging to see your son go through that all the time. He's happy for me to take care of his son between here and hospital, and that is a privilege. I'm a father myself, so to hand that responsibility to a stranger is a big thing.
It is hard because we've been through it many times. The worst part about it that you're not able to immediately fix it. When you feel powerless, when you're asking doctors and they don't know what to do, it's the hardest part of it.
Because of past resistance to the drug midazolam, Dodsey's promised Daniel's parents he'll avoid using it.
There we go. Going again. You just want to make sure that his head is OK for me, David?
I think it's very important to make sure that Daniel's parents can trust that we'll care for him. But another risk with prolonged seizures is when that unconscious fit, their tongue can actually roll back and can occlude their airway, so inevitably they could stop breathing as well. So my eyes do not come off Daniel for the whole transport.
It must be exhausting for parents, particularly this has been going on for 17 years and they haven't faltered.
You back with me, Dad? Yeah. So we'll call that about another 60 seconds worth.
We're at the hospital, man, all right?
As promised, Dodsey has got Daniel to hospital without drugs. But nobody knows how long his fits will continue or if treatments will work.
Good work. You've done really well, buddy.
You're making the sound of an ambulance. He seems like he's getting excited already.
Leonard and Nicola are preparing to take 7-year-old croup sufferer Fletcher to hospital.
Looking better.
There's actually, I don't know if you heard him before, he was making the ee-or noise.
Oh, weird.
Given the severity of Fletcher's croup, the Micah paramedic Dom is going to travel in the back of our ambulance in case he deteriorates on the way to hospital.
You got everything you need? Yeah.
Fletcher and his dad Ben are supposed to be enjoying a fun weekend away in Melbourne.
Still a bit barky. You sound like a seal.
Now they need to break the news to Mum.
Don't panic, Fletcher's okay, but...
When you start a phone call with, now don't panic, the other person is going to naturally panic.
We're on the way to the Royal Children's Hospital because it looks like we might have croup.
So Fletcher's dad has a really tough job trying to reassure his wife that everything's under control.
Mum's a bit worried about you, Fletch.
It's like 800 people in the room.
Being an up-and-coming father, I find that I'm much more empathetic towards parents. I can only imagine that that would be a really tough phone call to make to your wife, and I just hope that I'm never in this position.
Okay.
Make a better sound than the siren, I reckon, Fletch. Now, I reckon if we ask Leonard really nicely, he might show us the lights before we go inside.
Fletcher's sightseeing trip to Melbourne is now on hold. His croup is so bad, he could be stuck in hospital for days.
Now, do you want to see the flashing lights?
Only time will tell if he'll ever get to see the real city lights.
Oh, I don't know if you can see behind you. Look at that. Wow. How's that? Pretty cool, huh?
It's now 2 months since Daniel was admitted to hospital with back-to-back seizures. Daniel spent 6 weeks in ICU before his fits were brought under control. It was a testing time for parents Hannah and Dimitri.
You have to keep positive. You have to believe that tomorrow will be a better day. Sometimes you're going away from ICU and, feeling very down. The next morning you're coming in and you see Daniel sitting up in the bed and smiling, and amazing what human body can do.
Daniel's had a lot less fits lately, giving him more time to catch up with his buddy, nephew Cooper.
Uncle Dan is the big builder.
He's a handful. I just have to live with that.
I don't like wrecking the really special stuff, so don't wreck.
Daniel is a very good person. His heart is full of gold. He taught me so many things. Watching a person going through such a diverse condition and making the best out of it is enormously satisfying.
After an awkward takedown at jiu-jitsu, Mark had his wrist x-rayed and was sent home from hospital with ligament damage. He's now back at martial arts with Bruce, and the couple is still planning a family. It's 4 months since 71-year-old Doris suffered her potentially devastating hip injury.
Hi, Blondie, would you like a cup of coffee or tea?
Yes, please, cup of tea.
But with a brand new hip in place, Doris is back in the loving arms of her family.
I said to the doctors many times, I said, please don't let me go. Just make me alive, just for my family. I love them with all my heart. only live for them. Thank you.
Be careful, it's hot.
It's all right.
Doris endured several hip replacement surgeries and a nasty infection, while husband Simon held the fort at home.
When I saw at home, my heart was open up, I was so happy. Do you remember this picture?
Of course I do.
About 30 years ago.
Yes.
51 years together. And we still love each other. Beautiful. She's still beautiful. Hi, Doris?
Yes,
How about give me a kiss for that? Thank you.
7-year-old croup sufferer Fletcher spent one night in hospital before he was well enough to go home. Dad Ben made up for their disastrous city break by taking him camping. And it's now 3 months since Jared nearly bled to death after crashing through a window at his parents' home.
Apparently I lost 7 litres of blood, and yeah, my body was shutting down. They told me that I actually died. The doctors had done an amazing job to keep me alive.
You reckon he's grown since the last time you seen him?
He has grown.
Jared had a blood transfusion, 4 operations, and a skin graft.
How you feeling, mate? How's your arm?
There's no feeling through here. I got feeling in my thumb. The doctors just told me it's going to be a long 12 to 18 months before they know what operations they can do on it and what feeling I'm going to have in it.
Since social, having you back helping again, mate?
I'm glad to be back, Dad. I've missed it. Me and Dad had a bit of an argument that night. It was an argument about work. I lost my temper. I put my hand through a window. And that's how I done the accident. That's how I lost the blood. So, yeah. Good boy.
I did think that we were going to lose him that night. But he's off the alcohol, he's off the drugs, and as parents, we couldn't be happier.
It's good to be back around the horses, isn't it? This accident's been a real eye-opener to me. It showed me how important life is to you, how much your loved ones are worth to you, and I'm just grateful and happy to be alive.
Come a long way.
Happy that time.
Emergency services. Go ahead, caller.
I've got a gentleman stuck in a tub. I can't get him out. He's 78 years old.
A frail, elderly man has been found trapped in a bathtub. His best friend is now on the line.
Now he's complaining his head hurts, which means he may have fallen.
I'm organising help for you now, so stay on the line. I'll tell you exactly what to do next.
99, receive that, thank you.
Intensive care paramedic Glennis is on her way.
If he's been there since yesterday, he might have some sort of exposure issues. Is he completely alert?
Yeah, but he's not coherent.
I hope they've kept topping up the water with hot water. Hypothermia is clearly a problem with someone who's been immobile in a bath and undressed for a long period of time. I've thought about that myself, You're in the shower and you think, oh, I feel a little bit of faint. If I ever had to call the ambulance, I'd say, dress me, put me in my full clothes, get the hairdryer out, do a little bit of my hair, put a little bit of mascara on me, and then call the ambulance. Here they are. Response 99, could you mark me arrived, please?
There's no way of knowing what's wrong with this man. I don't know whether he's been topping up the water and keeping himself warm or he's absolutely freezing. The consequences could be quite catastrophic.
There's 4 days' worth of newspapers here.
With unopened newspapers on the front porch, it now looks like the man could have been trapped for up to 4 days.
Is he in water?
No. He's dry. He's bone dry. So if he was in a bath,
yes,
he's obviously been out of the water long enough for him to dry by the environment.
Are we covered?
Dan just brought him some blankets.
Dan?
Yeah. His mate.
Dan, who discovered John in the bath, is still shocked at finding his good friend in such a heartbreaking predicament.
I tried 13 times to call John, so I only lived 10 minutes away. I came down to check on him. I have a key to the place. I unlocked the door and found him in the tub, shaking and scared. He has a bit of dementia. He's not real lucid all the time. He forgets a lot of things.
With the traumatised John unable to tell them what happened, the paramedics need to get him out of the bath urgently to assess his injuries.
No head strike?
He's complaining of head pain. But I haven't had it a good feel yet, just because of the position he's in.
Yeah.
There's a couple of problems with him being in the bath for a long period of time. He could have hypothermia. He hasn't moved those joints in 4 days. So when we start trying to get him out and pulling on his limbs, he will be in significant amounts of pain. Clearly, this man could be in a bit of strife.
It's a beautiful day to be hanging out with my Tasman.
Aren't you lucky?
Paramedic besties Taz and Amanda are waiting for their first case of the day.
Lucky lady.
Where else can you find a partner like me?
1 in a million, Taz. 1 in a million. How many people are there in India?
1.3 billion.
So are you 1 in 1.3 billion as well? Yeah. Okay.
I'm a limited edition.
Limited edition.
Yeah. When God created me, he only made one of Taz.
Only one Taz.
The one and only is now on his way to a job at an unusual location.
All right, Tazzy, we've been dispatched code 3 to a 65-year-old female who is at a cemetery who has fallen and injured her shoulder. Do you know people that live in Springvale can't be buried in that cemetery?
No?
No.
Why not?
Because they're alive.
Good one. Good one.
Amanda's jokes? Terrible. I think Amanda should leave that part to me and she should just concentrate on doing the paramedic job.
Quiet neighborhood.
Hello.
Hey, how you doing?
Good, how are you?
So he's got to escort you.
Oh, beautiful. A VIP escort.
I want to ride that.
I feel like the Queen.
As Taz and Amanda pull up, a single responder is already on the scene.
Yeah, it looks like they've been at a funeral.
The patient, Katerina, took a tumble and paramedic Dave thinks she's dislocated her shoulder.
Push up with those legs. That's a go. 1, 2, 3.
That's it.
Push up. Sit.
Oh, it's a bit sore, is it?
Yes.
Pain relief has already been given, but the patient will need x-rays at hospital.
I'm feeling sorry for this poor lady. You know, she's had a pretty average morning attending a funeral, so it's not a very nice end to not a very nice day.
I've never been in an ambulance. This is interesting.
Well,
there's always a first time.
That one off the list.
We get her in the back of the ambulance and she's really finding it hard to find a comfortable position.
You think hanging is the way to go?
I think at the moment.
If that's what's comfortable, then that's what we'll go with.
Can I hold you?
Absolutely you can, no problem at all.
So I start to talk to Katerina, try and distract her from the fact that she's in so much pain, just get to know her a little bit. So I asked the question.
So I suppose you don't really want to talk about it, but whose funeral was it?
And then I heard a story I'm not likely to forget anytime soon.
Very interesting. I had a car to be fixed.
Yeah.
And it was with my mechanic for 3 years and the bugger didn't get on with it. Then he died on me. And that was his funeral.
Am I hearing this right? She's come to a funeral to find out where her missing car is.
Response 99, I'm en route.
Single responder Cam has just started his shift with a job that all paramedics dread. A toddler who appears to be unconscious.
We're being sent to a 15-month-old female that we believe might have had a seizure after a head injury, so it could be complex. Children are always scary because often they can't tell you exactly what's wrong. There is another ambulance on scene. They've done a brief assessment and they're requesting an intensive care unit. First priority is to calm the scene. Often with these scenes, you've got parents that are a little bit elevated as well. So we'll see if we can just get on top of that and then find out exactly what's happening. Response 99's arrived. G'day.
How are you? Mum's inside.
No worries. Hello.
Hello.
I'm Cam.
This is Jess and
Hi.
Isabel.
Hi, Jess. Now, we got a story that she might have been kicked in the head, or was it just from the fall?
She just, a little boy jumped off the ledge. It would have been
Yep.
his height near ground, and
Yep.
his foot just hit the side of her head. Truly, within like 20, 30 seconds, she started having a seizure.
Okay. Do you want to lie Isabel down here and then we can have a little look at her? Did she go really stiff and then start
and her eyes
shaking?
started
rolling back?
And her jaw started
Yep.
going side to side.
Yeah. And then afterwards, has she just been like this the whole time?
Yeah.
This would be awful for any parent to witness. Hello, honey. Hello. We have a period after a seizure that's normal to be in an altered conscious state or possibly unconscious. But after that, you expect to see signs of waking up and movement. So the longer somebody stays unconscious, the more I'm starting to think, is there something else going on? Isabel might have a possible brain injury. She feels really warm on her head, like she feels warm.
Isabel's mum, Jess, is managing to hold it together, just.
She's never been sick, never had any seizures before. Her nose and her lips started going blue. She was just grey all over. She wasn't moving. I thought that she was probably dead and that we'd have to give some rescue breaths and start CPR. So it was really terrifying.
Hey, little miss, I'm just going to try and wake her up in a tick, and if she doesn't wake up, then I'm going to get the other guys to give me a hand. Hello? Often after a seizure, people have a degree of unconsciousness, but now it's time to wake her up and see if she really is unconscious or she might just be tired after such a traumatic event. She might not like this. Hello? Little miss? Hello?
I had a car to be fixed.
Yeah.
And it was with my mechanic for 3 years and the bugger didn't get on with it. Then he died on me.
At the Springvale Cemetery, Amanda can't believe the story she's hearing from her patient, Katerina.
I think it's absolutely incredible that this woman is cheeky enough to turn up to her mechanic's funeral to find out where her car was. They say truth is stranger than fiction. You could not script this.
It's locked up and I needed to meet all the people so I know where my car is.
Were you friendly?
Yes, I've known him for 10 years. He was a decent guy.
Yeah.
Ready to go?
Yeah, I'm good. I'm good to go.
It looks almost certain that Katerina has dislocated her right shoulder after falling over, but she's still chatty.
I'm 82.
Are you?
Yeah.
You're 82?
82.
Are you sure?
Positive.
You look fantastic for 82.
Yeah. I was 79 when I retired.
79? You're just a go-getter, aren't you? Look at you. Do you know the information came through on our screen and it said that you were 65?
Yeah?
Yeah. So there you go. Somebody else thought you looked young too.
What a stupid thing to do today, to go to that funeral.
Yeah.
To put a curse on me.
Look, I don't think you've done anything too sinister, so we'll see.
Here we are.
We're here. That went fast, didn't it? Time flies when we're having a chat.
Katerina will now be x-rayed to find out just how much damage she's done to her shoulder.
Just a couple of bumps, okay, Kate?
Oh, don't drop me.
We won't.
Behind the closed door in the back of the ambulance, we hear strange stories all the time. But this story is going on the top of the list.
Okay, let's go.
Hey, little miss, I'm just going to try and wake her up in a tick, and if she doesn't wake up, then I'm going to get the other guys to give me a hand.
It's been more than 30 minutes since baby Isabel was accidentally kicked in the head and suffered a seizure.
Hello?
Micah paramedic Cam is worried about just how long it's taking the 15-month-old to fully regain consciousness.
I just need to see if she will rouse to a little bit of painful stimulus. So I just give her a little squeeze on the nail bed. It's not something that I want to do, inflict pain on her, but I need to see if she's going to wake up. Here we go. Oh, no, I'm sorry. I'm sorry. And she does, thank God. This would be full on for her to wake up to this, obviously. Hello? Hello? This must be very overwhelming for her. Last thing she knew, she was in the playground having fun, and now she's waking up to some ugly monster with a beard and a bald head peering over the top of her. She's hooked up to all this equipment in a strange environment. Hello, miss. Is she normally pretty good with other people?
Yeah.
So you going to be all right with me lifting you up? There we go. Isabel's been such a good little girl. She's letting me hook up probe equipment to her feet to measure her oxygen levels, and she's strapped in. At the moment, I'm happy to just take her to hospital like this. She's been great. Oh, come on. Then she starts howling. Are you not happy? Well and truly awake now, obviously. I'm right to go, mate. Thank you. Medically, I'm not worried about her anymore. Oh, no. But she's downright disgusted to be in the back of an ambulance. Normally we get a little teddy bear in the trucks, but they don't have one. I'm no balloonist, let me tell you. Here it is. Here it is. I'm doing my best to try and entertain her. Do you want to play with Mr. Balloon? Here you go. Nothing's winning. She is over me. Do you think she'd settle a bit if you were here? So I asked Mick to pull over so I can get Jess to sit there and reassure her. OK, thanks, Mick. Good on you. I don't think she's going to like anything at the moment. Tell you what she doesn't like, the back of an ambulance. I might have left it a little bit long for even Jess to calm her down. She's worked herself into such a state. You know what? Here we go. Go for it. There's only one thing she needs now, and that's a cuddle from Mum. Oh, is that it? Is that what we needed?
Isabel is finally happy, but Jess won't stop worrying until doctors test her daughter and hopefully give the little one a clean bill of health.
See, like this, she's been an angel the whole way here, mate, like this.
And so he was naked though. But he could have fallen in there, couldn't he? He could have slipped in and fell in.
Single responder Glennis and a team of paramedics and police are trying to get their terrified patient out of his bath.
I'm thinking if you fell into a bath, you might fall the wrong way. If you're actually taking a bath, your head would be at the other end, away from the faucet.
78-year-old John lives alone and suffers from dementia. Sadly, it appears he could have been stuck in the bath for up to 4 days.
We're just getting the door off, mate, so we can get to you.
This must be really confronting for John. He is naked inside a bath and he's got people all in his tiny little bath looking at him. So we go as gently as we can.
John, we're just going to try and take this pane of glass off, mate, so it gives us a bit more access to you and we can hopefully get you out very shortly, OK?
As the paramedics turn into tradesmen, the man who found John is anxiously waiting for news about his mate.
You right down there, John?
Yeah. We just want to get you out safely, mate.
I am worried that it's taking so long.
Do you want me just to quickly Google how to take the screen off?
He looks like he's in shock because he's shaking, he's incoherent, and, he's just very white. He's lost the colour.
Here we go. Oh, look at you.
We haven't wrecked it, mate.
John's super scared. So it does take all our best efforts to keep him calm and relaxed and try and show him that we're here for him today and that we will look after him.
Well, let's get him up first.
Manual handling expert Bruce has arrived with specialist equipment to lift their elderly patient out safely.
That's it, buddy. That's it.
You going all right, John?
Yeah. We've got you.
If I hadn't checked on John today, there is nobody else. He would have just passed on in the tub. What a way to go. It's tough. He's a good friend.
Just all right, test us. Let's get you out of here. Get backwards.
Every time I walk in, he goes, I got a bone to pick with you. Where have you been, Because he hasn't got anybody else to come see him.
Get backwards. Wasting our cat.
You got a cat?
Yeah.
John was really reluctant to come to hospital with us after we got him out. He was worried that who would be there to look after his cat.
I don't want you to worry about Princess. I'll take care of Princess, okay? I'll make sure she's fed and watered. Seeing John like this, it makes me see life in a little different manner. That could be me laying there.
You're right, here, grab onto me.
And to see somebody that you've known as long as I've known John, it just hurts. Just, it's not fair.
Push. Oh,
Wow. Here we go.
Okay? I'll take care of the cat. I've told him that if he goes into a home, I wouldn't take care of Princess, but he still wants to take care of Princess. Princess is his life.
hello, lovely. Hey. Oh, you're well fed.
So do you live there by yourself?
Yeah. He's so frail. It's a big concern as to whether he makes it through this.
See you when we see you.
Not long to go now, huh?
It's getting pretty close. I'm getting scared and excited, but mostly scared.
Yes.
It's the start of night shift for Nat and Leonard, and they're talking babies. Leonard's about to become a dad for the first time.
You should be scared and excited, though.
You should be telling me that things are going to be okay.
It's sleepless nights, it's crying, it's nappies, it's vomit, it's
But
poo.
on Instagram, all parents look happy. Is that a total lie?
Yes.
But the teasing stops when the team is called to help a driver who's lost control.
Emergency services, tell me exactly what's happened.
A car's veered across the median strip and just gone straight up onto the embankment on our side of the road and into the bushes. And we can't get him out of the car. We believe he's having a fit in there.
What makes you think he's having a seizure?
We could see him shaking around in there.
Don't move him unless he's in any danger, okay?
It states there's a car versus bushes.
Okay.
We know it's a male and possibly having a seizure. They're trying to get into the patient. So I can only imagine he's trapped inside the car.
Okay. So whether he's had the seizure that's caused the car accident or whether he's had a car accident that's caused the seizure.
Yeah, which would be extremely serious
We
either
don't
way.
know.
But I'd be really concerned about obviously traumatic head injury. I can't see anything just yet.
I can see some... I'm having a bit of difficulty actually finding the car accident. Usually we have a waiver that beckons us, but tonight there's no one around.
Is that it?
Oh yeah, you're right, there's light.
Now that's going to be hard to get into.
Oh wow, he's actually in the bushes.
Caller unable to get into patient.
Yeah.
Vehicle still running.
Okay,
Very
we've got to
odd.
be careful, don't we?
Yeah, we're going to be really careful here.
As Nat and Leonard approach, they can see the crashed car is nose deep in thick bushes metres off the road.
Where's the caller?
Just going to have a quick look.
I think we get the fireys.
Let's get the fireys. Hello? Hello, can you hear me?
The engine of the car is still running. This is a really dangerous thing. At any given moment, that car could take off or even reverse onto me.
Can you turn the car off?
Turn the car off.
I'm really worried it's going to reverse.
Yeah, I know.
Can you turn the car off, sweetie?
Turns out the driver is a she, not a he, and she is not responding.
I'm just a bit worried. She's going to hit the accelerator. Don't get out there. Turn the car off first.
Hello? Hello? Can you turn your car off?
What a day. We've done nothing. I'm really disappointed. What?
You're going to have jinx us with an hour to go. Now settle down.
Right, okay.
Easy, tiger.
Settle pedal.
Tonight, veterans Glennis and Dodsey have teamed up, but so far, it's been uneventful.
Now we're all yawning.
I met Dodsey about 17 years ago and I said, what would I have in common with Dodsey? He's covered in tats, he looks like ZZ Top, but I have never been proved more wrong in my life.
Oh, I'm yawning now.
We have a special bond, me and Glennis. We've shared a lot of things over the years, you know. She's my ambulance crush. I love Glennis.
If I fluff them, will they come up?
Doing.
Oh! Hello. Breathing problems. 62-year-old short of breath. Could be an arrest.
As Dodsey and Glennis head lights and sirens to the Code 1 case, the distressed patient is still on the line to the Emergency Communication Centre.
I got grease. Okay, are you there by yourself?
Yes.
Do you have cold sweats?
Yes.
Okay, I'm going to stay on the line with you until they're right there with you. So if anything changes, you just let me know, okay?
You are clear left.
All
315.
lanes. Thank you.
So being breathless could be anything from having fluid on the lungs to a chest infection, or potentially it could be someone's heart's not working and the fluid's backlogging into the lungs.
Hi guys, I'm Glennis, this is Paul. Let's see what's happening.
I haven't quite got any words yet.
When Dodsey and I walk in, the other crew are already knee-deep in it. What we're greeted with is a man who's grey. This doesn't look good. He looks like he's about to arrest.
What's your first name, mate?
Evil.
All right, no more.
This man couldn't really talk to us, so we couldn't get a lot of history from him. I can hear that his breath is rattly and the heart's not pumping blood forward, so I think there's a lot of build-up of fluid in his lungs.
Have you got any pain anywhere? Have you got any pain in your chest?
We think this man's having a heart attack and he can't breathe. He's really sick. We don't have a lot of time. We need to move quickly.
All right.
You're right.
Just breathe in and out, okay?
Hi. We just worry she might hit the accelerator and the car actually may go backwards.
At the scene of a bizarre accident, Nat and Leonard are concerned the trap driver may have serious injuries.
She's in the front, looking a bit dazed.
With the car engine still running, it's too dangerous for them to approach.
You've organised a tow, have you?
Yeah, the police are organising a tow.
More emergency services are arriving to help get the driver out of the badly damaged car.
G'day, mate. Got one patient. We're not too sure why she's kind of veered off the road. Yeah.
And the car's off now, isn't it?
It is.
With the engine now switched off, Micah paramedic Shannon can assess the patient before they move her into the ambulance. But suddenly, the woman opens the car door and gets out. She's dazed and struggling to stand up.
She's not really sure what is actually happening, but then she turns around and I see this massive bump on her head.
I recognise the patient.
Do you?
If this job wasn't already strange, it gets even weirder because I quickly realise that I actually know this patient. She works at a hospital that I frequently visit and hand over to.
Hi, love. We're going to pop you on here.
What was her name again?
Anouk.
Anouk.
Hello, darling.
Hello. Do you want to have a seat over there?
She works at the hospital.
Can we get you into the ambulance away from all the lights where we can talk properly?
That's all right.
I've got your bag. You've been involved in an accident, darling, so let's take a seat and we'll talk inside.
Have a seat. That's it.
better.
There we go.
You had an accident driving home.
She's obviously confused, disoriented, not sure what's going on or why we're even there. I'm starting to worry that there's something really serious going on with this patient.
So what's my car?
That's your car.
Anything wrong with it?
A couple of scratches. Where? Just on the outside.
Do you have any pain at all in your chest? Have you had fluid on your lungs? Have you been to hospital with this before? Nothing?
Glennis and Dodsey are almost certain their patient is suffering a major heart attack. He's finding it so hard to breathe, he can't even tell them his name.
He is terrified. You can see it in his eyes. His body has shut down all the blood vessels to his skin and they're trying to drive the blood back to its brain and the heart. He is not a well man.
You've never had heart troubles?
62?
We think this man's having a heart attack, so we need to get those ECG dots on. Problem is, he's sweating buckets. So we're just trying to get a trace and see what fundamentals we have or what baseline ECG we have.
Wouldn't mind a little look at that ECG. All right.
Left bundle failure.
The readout confirms the man is having a heart attack. He could be close to cardiac arrest.
These I'm just putting on just in case. His heart is failing. It's not pumping the blood forward to the rest of his body as efficiently as it should, which means the blood backlogs up into the lungs. So this man would be feeling like he's drowning.
All right. How long have you been short of breath for?
Well, I noticed the afternoon.
Yesterday afternoon.
After being put on oxygen, the man's finally able to get out a few words.
When I went to bed.
Yep. You lay. Yeah.
I couldn't breathe.
All right.
This man is the sickest I think he's ever been. And if we hadn't arrived when we did, it would have been catastrophic for him.
I'm going to put this blanket over you.
With the patient so critically ill, his only chance of survival is getting to a cardiac unit.
All right. Yep, let's go.
Extricating him from the house is really quite difficult because we know that the heart is already under full load. So if he has any form of exertion, that could tip him over into cardiac arrest and he could die.
Do you know what's happened tonight? No.
Leonard and Nat are examining the dazed Anouk. She's just veered off the road and crashed her new car.
Were you driving to work or from work? Because you look like you've got your work clothes on.
I do.
Do you reckon you're on the way to work tonight?
I don't know.
Not sure.
The fact that she's got such a large bump on her head and that she's so confused makes me really concerned that she's potentially got an internal head injury.
Is there pain anywhere else on your head?
No,
No? Any pain on your neck?
no. I don't even know. My car's all right.
What we're going to do, and you probably know what I'm about to say, we're going to take you to hospital.
What do I need to go to hospital for?
Well, you've had a pretty major car accident.
I want to have my car.
Destination. When a patient hits their head, the brain shakes around in the skull and they present with what we call retrograde amnesia.
I wanted to check out my car.
No, we can't do that.
Why can't I look at my car?
The car's not in a good shape. So this is what we're going to do,
I
Anouk.
don't want to have a look.
No. Anouk, what we're going to do, you'll get your car back, but we need to put a collar around your neck, and then we're going to take you to the hospital.
All she can focus on is what's happened to her car.
Just look straight up, Anouk.
Whereas we're focused on what's happened to you.
No, keep your head straight. You know what to do.
Anouk is a nurse at a local hospital, but that's not helping.
Look at the smiley.
Look straight up. Don't move.
The confused patient is not happy about having to wear a protective collar.
Let's go.
Let's go. Otherwise,
go.
worst comes to worst, I'll just have to take that off.
We're gonna otherwise
Because it's just irritating her.
I really want to see my car.
Anouk, you need to stay still.
The whole point of the collar is to keep the patient rock steady, dead still, to protect the spinal cord.
You need to be still, Anouk, you know that.
She doesn't want to bar it. She's looking around, she's trying to get up. It's just not working.
Anouk. All right, I'm taking the collar off.
Right, good to go.
Good to go.
Too much distress?
Yeah, too much distress,
No worries.
irritation.
I truly hope I don't remember crashing. I would seriously love to know what happened.
To be honest, me too. But I think I have a fair idea that a medical event, whether it was a seizure or whether it was you blacked out for some other reason, has happened. Because, like you said, you felt sick, you wanted to vomit, you don't know anything about the crash, and the next minute, we're inside the car trying to get you out.
This is the worst day ever.
But Anouk's devastating day is not over yet. Leonard and Nat are concerned about just what doctors will discover when they examine the bewildered nurse.
I've still got so many questions. What caused the accident? Is there internal bleeding going on?
We're pulled into the hospital, so we'll get you straight in.
Anouk definitely had a seizure at some point. But what is the cause of that seizure and how serious is it? There's so much we need to still find out.
Guys, do you want to give him a hand down that end?
The pressure is mounting on intensive care paramedics Glennis and Dodsey. Their patient is having a major heart attack, but just moving him to the ambulance is risky.
We've got our CPAP.
His heart is quite vulnerable at the moment, so we need to move him in a nice, slow fashion, make sure that we get him onto a bed and not too much activity because it could lead down the pathway of him having a cardiac arrest.
Can I have my monitor?
You want yours?
The man is struggling to breathe and urgently needs more oxygen.
I'm just going to stick a mask on your face, OK? It's going to be uncomfortable, but it's on there for a reason. Glennis, can you hold this, please, whilst I put this on his head?
That's it. Nice breaths. Now, you sure you've got no pain? You've got no pain? All right. What's your first name?
Where's your wallet, mate?
The paramedics are still trying to find out their patient's name.
Here you go.
What is it?
Ivo? Perfect.
It is nice to finally find out what his name is, but Ivo's got a long road to get through. We've got to bring that blood pressure down. We've got to take the pressure off the heart.
That is ready to rock and roll. That is purged and ready to go.
Just going to pop this under your tongue. Don't chew that one. Just let that one sit there, love.
The hospital is 10 minutes away. In Ivo's fragile state, every second counts.
So mask on, plenty of O2, got a bag up. He's had the drugs that we can give him.
As the medication takes effect, Ivo's breathing is gradually improving.
I want to have another listen to that chest of yours. That's it. Oh, good. I'll give you a couple, hey? Back it. How you going? Do you feel better? Good. Righto, we're here now.
The team has got Ivo to the Monash Medical Centre alive. Cardiologists are on standby to find out if he needs immediate surgery.
All right, let's get you inside.
Good outcome. Good job. Good job.
I did look at him first off and I thought, oh my God, yeah, he's having a big heart attack.
Oh, he
Grey,
had
and
heart
I thought,
attack written all over
if we
him.
don't get this line in quickly, he's going to arrest on me.
Hopefully they'll tickle him into the cath lab and have a look and make sure his ticker's doing all the things it's supposed to be doing.
Yeah. Oh, and the nursing staff took those pads off and put their lovely little small ones on.
He got a free chest wax.
Yeah. Poor bloke.
Ouch.
Oh, well.
We're going to a gentleman. He's sitting on the road. It says he's unable to stand up. He's possibly hit his head.
The busy night is continuing for Nat and Leonard. They've just been called to their second emergency.
Actually, it's just changed to a stroke. I think it's...
Yeah.
This is unusual, isn't it?
This is very unusual. Down an alleyway. Give me the thumbs up now.
Yeah, we'll just get the bed out though, Leonard. Are you okay with that? Hi, buddy. I'm Natalie from the ambulance service. Have you girls called us? You just found him here?
Oh.
In my experience, stroke patients don't typically greet you with a thumbs up when you arrive. Have you been drinking?
No.
Can you see me?
No.
Do you want me?
Oh, no.
I've had some mixed reactions when I've asked men do they want me in the past, but there's no mistaking this patient. It is a most definite no.
No.
Okay.
We got Shicky's fixed, English.
Okay. You've been drinking a lot of alcohol?
Yeah.
All day?
Yeah.
Yes. We need to take you to hospital.
Yeah.
Yes? Excellent.
I love you.
You love me?
Wow, that's very quick.
He loves me.
So alcohol intoxication can actually be very dangerous.
I love
Can
you
you
too.
bend your legs? Because you need to stand up.
It's not as simple as just letting them sleep it off. You can end up vomiting and choking on the vomit and dying.
You need to get up and go over to the bed.
I want him on... Yep.
How about you just do that?
On...
And you get on your knees and you crawl.
We're trying everything here, but nothing is working. One arm. On. It's like we're playing a game of charades.
I don't know.
Can you demonstrate what he needs to
get
do?
on my knees.
Can you roll onto your hands and knees? We're all having a bit of a laugh, but at the end of the day, it's a cold night. We do need to get him up off the ground. You need to get up onto the bed. Do you understand?
Moving this patient is turning out to be anything but straightforward.
Careful in case he vomits. Vomit that way. That way. Drunk people can actually be harder to move than unconscious people. Not only are they a dead weight, but they can actually be quite resistant and combative to what you're asking them to do. Why don't we get the evac mat, roll him onto it and just slide him up, and then no one's lifting up. Hang on. Oh, God. He's too intoxicated to get up himself.
RC 715, can we just get back up here? I've got difficult extrication.
The evacuation mat is a fantastic piece of manual handling equipment which enables us to safely move patients from the ground and onto the stretcher.
The backup crew has now arrived and Nat and Leonard can try Plan B.
Ready,
Your call.
set, go.
Oh, and the rain's coming too. Fabulous. There we go. Okay, thanks, guys. Okay.
I'm Russian.
I'm not Russian. Not Russian. English? Da? Small amount. Oh,
Not a vomit?
no, that's a hiccup.
Oh.
It's been a marathon effort to get the man into the ambulance, but they can finally start the short journey to hospital.
Blood pressure is up. Yes. Because of me? Me!
Yeah, because you're probably getting him all excited.
Settle down. We very often deal with intoxicated patients. Many of them are often aggressive or abusive towards us. So it's really refreshing to meet someone who's a really happy drunk.
Just a little bit drunk.
A little bit.
Little.
No, I think a lot.
Спасибо.
Thank you. I gotta thank you.
At the Alfred Hospital, The man will be closely monitored until he's well enough to go home.
He's probably going to wake up tomorrow morning feeling pretty lousy, but at least we know he's going to wake up. It's a good thing those girls found him when they did.
Can I have vodka?
Can I have vodka? No. Pop it in here, number 1. We'll find number 2. Where's number 2 gone?
Little Isabel has done a lot of growing since she had a frightening seizure.
Well done.
When intensive care paramedic Cam rushed to her side, she was still unresponsive.
Did you see the seizure? Did she go really stiff and then start shaking?
Started
rolling back.
And her jaw started going side to side.
Fortunately, tests at the hospital cleared the toddler of epilepsy or any other long-term medical conditions.
She's been fine, completely fine. Definitely hasn't had any more seizures. Ready? Do you want to hop on the back?
Now Isabel's only concern is keeping up with her twin brother, Harrison.
Ready? Beep, beep. I think we're very, very lucky that she's not sick and that it was just a one-off. Go on, hop in. She's just the sweetest little thing.
Whoa! What's your first name, mate?
61-year-old Ivo was diagnosed with a major heart attack and spent 2 weeks in hospital.
These I'm just putting on just in case.
Several weeks later, he was readmitted. A blockage in an artery was removed and a stent successfully inserted into his heart.
My car.
That's your car.
Nurse Anouk was dazed and confused after her car suddenly veered off the road and crashed into bushes. Tests cleared her of any neck or head injuries, and she escaped with just a black eye and bruising.
I really want to see my car.
Anouk's much-loved new car did need some surgery, but has made a full recovery.
I've never been in an ambulance. This is interesting.
As for Katerina's missing car,
It was with my mechanic for 3 years and the bugger didn't get on with it. Then he died on me.
she's finally tracked down her wheels and has fully recovered from her dislocated shoulder.
You put a curse on me. He could have fallen in there, couldn't he?
Terrified John was found trapped in his bathtub, shivering and incoherent.
You right down there, John?
We just want to get you out safely, mate.
The 78-year-old spent several days in hospital, recovering from exposure and the impact of his ordeal.
See you when we see you.
Knock, knock.
Dan, anyway.
How you going, bud?
John's now safe in an aged care home.
Yesterday was the first day I could walk.
You're moving along pretty good.
And the man who saved his life is a constant visitor.
I can't tell you how happy I am that he's in care and he's being looked after.
Hello, princess.
As for John's cat, Dan came to the rescue again, giving Princess a loving home.
You know who's playing footy tomorrow night?
Yes, Colin.
Yep.
You know, we're friends, and friends take care of friends. It's pretty simple.
You've come such a long way. That was better than before you were in the tub.